I'm Jessica Hafner with Holland Hospital Medical Group General Surgery. As a general surgeon, I'm commonly asked, what do I do as a general surgeon? Of course, you see me in my office for a consultation with whatever the problem is, but do I do surgery there in the office? For certain small things I do, but for most things we do in the hospital. So the types of things that I usually do most commonly are hernia repairs. I do belly buttons, groin hernias, ventral hernias. I do gallbladder surgery, I do colon surgery, and I do a lot of screenings like for colonoscopies and colon cancer screenings too. So there's a lot of variety for what I do, but we give great care despite doing so many different areas of the body. This is the basics of how a general surgeon trains, doing every body part. For pretty much all the surgeries that we do, most things are allowable to do at what we call minimally invasive, which means little small incisions, like the keyhole operations, where we make small incisions in the body instead of bigger ones to get out the gallbladder or fix a hernia. We do Da Vinci robot surgery as an option, which allows a quicker return to activities, less pain, an easier recovery overall, especially compared to the older way of doing surgery. The great thing about Da Vinci robotic surgery is that these smaller incisions that we're able to use just causes so much less trauma to the body. Instead of making a bigger incision in the groin that's 3 or 4 inches long, we can make 3 incisions that are 8 millimeters long. And you can imagine the pain difference between those two patients. It's extraordinary. There's lower risk for infection, commonly too. There's just less restrictions after surgery, which is why you can get back to what you want to do sooner. I'm Jessica Hafner with Holland Hospital Medical Group General Surgery. Please call me if you have any questions.